Good day, everyone. Welcome to Module 13D. In our previous Module 13C, we talked about bathing, back rubs, and providing clean dressing for our patients as home health aides or personal care aides. Today, we'll be discussing still on the procedures, assisting with changing a clean dressing, in brackets, non-sterile. Assisting with changing a clean dressing, non-sterile. What is a non-sterile dressing? When we talk about non-sterile dressing, it means that these dressings are not invasive. Like I said earlier, I said in one of our lectures. Example of this thing on the board is a clean dressing. It is not a surgical wound. It is probably just a normal wound. Maybe a cut, just a bruise or the likes. So most of these ones are clean. They are clean wounds. They are dressed clean. Because they are not sterile, it doesn't mean that they are dirty. No, it's clean. So how do we do a clean dressing? Now, introduction goes as follows. Home health aides or personal care aides there are two main people we look at here. Now, home health aides, they are able to provide assistance with performing or changing a clean dressing. They may not change sterile dressings. And sterile dressings are used over new, open, or draining wounds in which sterile techniques must be maintained. And this is to prevent introducing bacteria and other pathogens into the wound and causing infection. While clean wounds are dressings that are mostly applied to, they are dressings that are applied to most dry wounds, and they have a less risk of getting infected. Now, personal care aides may not provide assistance with changing any dressing at all, whether it be clean dressing or it be sterile dressing. A home health aide may still be able to change a clean dressing, but a personal care aide may not be able to assist with us changing any dressing at all. Now, how is the dressing done? The first thing is to explain the procedure to the patient. You wash your hands and you assemble all the necessary equipment. Then you provide privacy and adequate lighting. Then you raise the bed to the waist height. Remember proper body mechanics. You lower the side rail nearest to where you will be walking. Then you place a garbage can near the area where you will be walking so that you can discard anything, garbages or things you have used. You remove any clothing necessary that is over the old dressing. Then you wash your hands and don gloves. You put on what? Clean gloves. Now, a clean table is used, which we place our dressing and our supplies. Then you remove wrappings from new dressing. You take care not to contaminate your gloves by touching any surfaces. You lay new or clean dressing on a clean surface. You can cut the tape with scissors, a clean scissors, and you have those tapes within reach on either the edge of the table, like the clean table. Then you remove and discard the old dressing. You peel off the tape by pulling towards the center of the dressing. So carefully, you lift the dressing off the wound to prevent the skin tearing or injury to the patient. So you hold the skin underneath the tape tight while pulling the tape off. Then you prevent the soiled dressing from touching the wound or other body parts of the patient or nearby surfaces or nearby objects. Then you observe the wound for odor, the drainage, the color, and healing or not healing characteristics. So you observe the wound, is it healing up, is it not healing? Then report this to a supervisor and document your findings. So if it is healing, beautiful. If it is not healing, that means things need to be done. Now, after removing the old dressing, you remove and discard your gloves, you wash your hand, and you put on a new gloves. Then you cleanse the skin around the wound according to the directions of the care plan and as directed by a supervisor. Then you apply a new dressing to the wound. You tape the new dressing in place and ensure the new dressing is firmly secured, and discard all the waste items. Remove and dispose of the gloves, and then you wash your hands. Then store unused supplies and you clean working area. Then document the procedure and any observation or changes in the condition. You record and report any changes or observations of the wound. And this is an example of what a clean dressing. So with this, we have come to the end of the procedure or the end of the module, talking about how to do a clean dressing. And a key important thing we learned here is that a home health aide may perform a wound dressing, that's a clean wound dressing, but a personal care aide may not be able to perform either clean dressing or that's sterile dressing or the clean dressing. In the module, we discussed how this is done, and we explained that you have to introduce yourself to the patient and explain the procedure to the patient. Then you wash your hands. Then about gloving, any glove you use to touch a dirty wound should be removed and done. Then you put on a new glove to place the new dressing. And with this, we have come to the end of the module 13D. So we're moving to the module 13E in our next class. Have a wonderful day.